Well, I'm Don Williams, and in June this year, 2007, I'll be 75 years old. And I have had a lot of back pains, and I'll mention the reasons why in a moment, but what brought me here to Rick Morris was the fact that I started having trouble with my right knee and didn't know what the problem was. And everybody was telling me, well, it sounds like you got pain down your leg, it's a sciatica. So I checked and see who could check on a sciatica because I didn't want to look at surgery. And this situation came up, and so I came for an interview and consultation and found out that it wasn't sciatica. It was the femoral nerve that was pinched in my back and causing pain down my leg to my knee. And I could hardly walk when I came in here. And after the discussions with Dr. Morris, we decided that maybe I better go for the treatment because it made a lot of sense to me, and there's no way I wanted to even look at surgery because I know what that can do. It's not that guaranteed of a situation. So I just started getting pain down my leg, pinched nerve type thing down my leg. I didn't realize it was starting in my back, and it was going down the inside of my leg from my groin down to my knee, and when it would get down to my knee, it started getting worse all the time. And it got so bad that I couldn't put pressure on my leg because it hurt at the knee level. So I was using a little mixed up cane type thing just to keep pressure off so I could walk. I had back pains, like I say, for 53 years, but it was, if I'd bend over, I couldn't straighten up, and I had to do it real slowly. Mm-hmm. And what I had is I had the compression factor of the vertebrae, and there was nothing to do. It already ruined the discs up there or compressed them so much that I had no flexibility, and so if I'd bend over, I had to straighten up slow because it really hurt, and sometimes it did put a lot of muscle pain on me too. Mm-hmm. And so anything, sitting too long bothered me, driving too long, working in the yard, no matter what I did. I couldn't run anymore because I couldn't put pressure on my legs when I'd run like that. I could run, but I couldn't take it. And while I was going through the process here with the DRX 9000 decompression machine, we were talking about the other pain, and Dr. Morris looked at that and said, well, he ought to be able to do something with that. So we got rid of the femoral problem, and in so doing worked our way up and got into the old injury, and I am now in a position where after starting in June, we started on the program and I went through 30 treatments, and both of my pains were gone. And then since then I've gone into the recommendation of the gymnasium work with keeping my back in place by strengthening those lower back muscles to hold the decompression factor in place. And you have to do that with stretching and with strengthening those muscles down there, otherwise it'll go back to where it was, because at this age you can't hold anything back from going wrong, so you got to work on it. And now I've been in the physical workout at the gym since September, so that's 4 months I've been doing that, and I really don't have any more pain. And I'm going to continue with that because I'm a firm believer that what I've gone through here is the only way to do it.